Hello everybody, my name is Katie and I am a Virginia Lend trainee as well as a second-year occupational therapy student at Virginia Commonwealth University. As a part of the program, I have created this podcast episode about how chronic Lyme disease impacts an individual's ability to participate in activities of daily living, which include getting dressed, taking a shower, grooming, participating in social events, and going to school or work. While I believe that everyone could benefit from listening to this podcast episode, it is especially important for parents and caregivers of children with Lyme disease. I experience life with chronic Lyme disease, so I will also share some personal anecdotes towards the end of the podcast. My hope is that parents and caregivers would gain a better understanding about the impact of Lyme disease on their child's daily life and learn how they can support and advocate for their child as they battle this disease. One quick note, throughout this podcast, I will be referring to individuals that experience life with Lyme disease as Lyme warriors. So, what exactly is Lyme disease? Lyme disease is a bacterial infection caused by the bite of an infected tick bug. It can spread throughout the body, causing various symptoms such as fatigue, pain, migraines, dizziness, and cognitive deficits. Lyme disease is a spectrum. I like to think of it as similar to the autism spectrum disorder, and it affects every person differently. Some people have mild symptoms and don't realize they even have the disease, while others are completely debilitated by it. I am now going to play the audio of a quick 2-minute video about Lyme disease and the brain.
Lyme disease is a tick-borne illness caused by a group of bacteria belonging to the genus Borrelia. The initial sign of a Borrelia infection in most people is a skin rash at the location of the tick bite, which is often accompanied by flu-like symptoms. If the disease isn't treated in this early stage, over the following weeks or months, a patient may develop other symptoms that indicate the disease is spreading throughout the body and impacting other bodily systems, such as the cardiovascular and musculoskeletal systems. At this time, Lyme disease may also affect the nervous system and cause neurological symptoms. When Lyme disease affects the nervous system, the resulting condition is called Lyme neuroborreliosis. The symptoms of Lyme neuroborreliosis vary, but common manifestations include facial nerve palsy and other symptoms related to the dysfunction of cranial or peripheral nerves, and meningitis, which is an inflammation of the meninges. Some patients may also experience psychological symptoms, including depression, difficulty concentrating, disrupted sleep, and memory impairment. A small number of patients report symptoms that persist after treatment, although more research needs to be done to determine the origin of these ongoing issues. Borrelia bacteria don't produce any toxins, and thus it is thought that most of the problems associated with Lyme disease are due to side effects of the immune response to the presence of the bacterium. The main culprit is thought to be inflammation, which is a general reaction of the immune system to any potentially harmful or foreign substance. Borrelia are capable of causing a disproportionately strong inflammatory reaction, and this inflammation might be responsible for disrupting brain function. Some evidence, however, also suggests Borrelia might be able to directly damage brain cells. Thus, more research needs to be done to determine clearly all of the ways Lyme disease might cause neurological effects.
All right, I hope that audio helped you better understand what Lyme disease is. It's really important to note that there's a common misconception that everybody who gets Lyme disease sees a bullseye rash, but that is far from the case. Many Lyme warriors, myself included, never see a bullseye rash, so they don't even know that they have the disease. Sometimes it can be several years of suffering from unexplained headaches, joint pain, severe fatigue, heart palpitations, cognitive issues, and numerous other symptoms before receiving a diagnosis. By the time they do discover it, the infection has become multisystemic, meaning that it affects many organ systems. According to the Mayo Clinic, if you are fortunate enough to catch the disease early, it can be treated with a course of 10 to 14 days of antibiotics, usually doxycycline. However, if the disease progresses, intravenous or IV treatment is required, especially if you have symptoms affecting the heart and nervous system. However, it is important to understand that treatment for Lyme disease does not always reverse the disease, and it unfortunately can become chronic. Now we're going to move on to some research studies to explain further the impact of Lyme disease on people that have the disease. So first, a qualitative descriptive study conducted in the United Kingdom explored the changes in occupations experienced by individuals with Lyme disease. The results of the study found that participants experienced significant disruptions in their ability to engage in meaningful occupations, with symptoms such as fatigue, pain, and mobility issues playing a role. Most people were unfortunately no longer able to participate in physical activities such as hiking and other outdoor activities, leading to frustration, sadness, and poor self-esteem. A similar study that was published in PubMed titled The Impact of Clinical Characteristics of Lyme Borreliosis on Patients' Life Quality. In this article, researchers discovered that physical health is also affected due to symptoms like fatigue and pain, similar to the qualitative description study mentioned previously. And this is especially challenging for children that were previously involved in sports as a social outlet, or children that really enjoyed gym class at school, or even recess, because they aren't able to participate in different activities with their friends, which can be very isolating. Okay, and the last article I want to mention was published in the Chronic Illness Journal, and in this article, 82 participants who had a confirmed diagnosis of Lyme disease and had been experiencing symptoms for 6 months or more were recruited through various online platforms to complete the health-related quality of life questionnaire about their perception of their illness and coping strategies that they utilize. The results of the study revealed that the impact of quality of life varies significantly from person to person, but overall, emotional and behavioral health is most affected. Also, a very common coping strategy that is used is substance abuse, not so much in children, but just overall among the Lyme disease population. Those are the types of coping strategies that unfortunately people are using. More research is needed to further investigate the psychosocial factors that may play a role in the health and well-being of Lyme warriors. Okay, now I would like to shift gears a little bit and discuss the meat and potatoes of this episode, which is what parents and caregivers can do to support children as they fight each and every day tirelessly to get better. I would imagine that the thought of receiving a chronic Lyme disease diagnosis is more than likely a terrifying one. However, as an occupational therapy student and future occupational therapy practitioner, I want you to know that while there may not be a cure and your child may not get back to quote-unquote normal, occupational therapy can be extremely beneficial to all Lyme warriors. According to the Lyme Wellness Initiative conducted at Harvard University, occupational therapists can help compensate for the effects of many symptoms, as I've discussed earlier, such as brain fog, concentration issues, disorientation, fatigue, memory issues, pain, sensitivity to light, sensitivity to sound, and difficulty with word finding and sentence formation. More specifically, an occupational therapist can provide recommendations for modifying activities and adapting the environment to help a Lyme warrior more easily perform day-to-day tasks and activities at home or school or in the community that may have been impacted by Lyme disease. For example, if you're experiencing fatigue, an occupational therapist might recommend strategies for conserving energy. If you're unable to tolerate certain environments, an occupational therapist can help you develop strategies to decrease feelings of overstimulation in certain environments. As a parent or caregiver, it is necessary to advocate for occupational therapy services for your child when you meet with their physician, as it could greatly improve their quality of life, and it's not a therapy that is typically recommended by providers at this time. So, as a parent or caregiver, it can be easy to feel hopeless. You may not know how to support your child. And the best way to support your child is to show that you care and to believe them when they tell you that they are in pain or don't feel well. Lyme disease is an invisible illness, so you don't always look sick. And because of that, people don't always believe that Lyme warriors feel as bad as they say that they do. It is also important to be educated on the disease and its symptoms. There are many documentaries out there that are very educational and provide excellent insight into how the disease impacts day-to-day life. To name a few, Under Our Skin and I'm Not Crazy, I'm Sick are two documentaries that follow patients fighting for Lyme disease recognition and treatment. While they can be very difficult to watch, I would highly recommend that every parent and caregiver check them out. It is also important to encourage your child and ensure that they know that they are not a burden to you. Lastly, I encourage you to please find support groups. This disease is isolating not only for Lyme warriors, but also for their families, and it is imperative that you surround yourself with people that understand what you're going through and want to be there to support you. I would like to end this podcast episode by sharing some of my story with you. As I mentioned earlier, I am a Lyme warrior myself. I was finally diagnosed in 2017 after suffering from unexplained fatigue, pain, and dizziness for nearly 3 years. When I first got diagnosed, I did countless antibiotic protocols, but my condition worsened significantly in 2019 when I was studying abroad in Hungary. At that time, I came home and underwent 10 months of intravenous treatment. That was the lowest point of my life to date. I had to take a gap year from college, and I was completely debilitated. Simple tasks such as walking to the bathroom or brushing my teeth took every ounce of energy out of me. As hard as it was for me, it was equally, if not more difficult, for my family to witness. I have asked my parents to share their experience with being a caregiver for a child with Lyme. So I asked my dad what his experience was like of being a caregiver for a child with Lyme disease, and this is what he said.
So I would have to categorize it, if I had to, in a short and sweet way: exhausting, frustrating, and depressing. You feel powerless to help your child because you're continually getting mixed diagnosis or non-diagnosis from physicians. My daughter Katie is a fighter, but it still wears on you because you feel powerless. Doctors often do not connect and they do not communicate. They do not trust anybody else's tests. They oftentimes will require the same tests we've already done, and they may be conclusive, they may be not. So you feel like you're running in a circle. Read again: exhausting, frustrating, depressing, and add in expensive, because the bills add up quickly. Some doctors and the insurance still refuse even to acknowledge Lyme disease and or the symptoms it exhibits. But perhaps the biggest challenge is acting the part of a coordinator for all the physicians and the tests and the scheduling and the insurance. The handshakes are never there, and you feel like you're always pulling from different areas just to manage a cohesive treatment for my daughter. The result is just to smile and fight on.
I also asked my mom about what her experience has been like with being a caregiver for a child with Lyme, and this is what she shared with me.
There were so many layers of this experience that were unexpected. To begin with, when your child is sick, it is agonizing not to be able to heal them. It is frustrating not to know what kind of doctor to go to. And it's absolutely devastating to hear we don't know what's wrong, or let's run a bunch of tests. It took us close to 12 doctors and nearly a year and a half of expense and frustration before we finally were diagnosed with Lyme and many other associated diseases. Once the diagnosis came, it was scary, because at that point my daughter was so depleted, so not what she was, and was struggling in every aspect of her life, socially, emotionally, physically. The things that had brought her joy, she could no longer do. Her friends really didn't understand why she was ill or couldn't do things. And I'm sure she was scared and isolated, because a body that used to be one of her greatest strengths as an athlete was failing her. we got really lucky that we were connected with Dr. Jemsek, who most people travel around the world to come to. And he was right here in Washington, D.C. We were so numb when we finally took her to the doctor that we just accepted everything he had to say. It was only a year later that he shared with us that Katie was one of the sickest children he ever treated. The next decisions after the diagnosis were also scary. We were making decisions about our daughter's life, decisions to give her drugs that were untested, surgeries to implant a device and remove her gallbladder. And she was only 17, and we didn't know where this was going. There's also a huge financial impact to a daughter with Lyme or a child with Lyme. It's not covered. The resources that we had to put towards this were incredibly fortunate as my family rallied to help support the cost, which I will share is upwards of $100,000. So if you can get by the affordability piece and you can get by the pure terror of making decisions for your child without an end game in an untested scenario, the next hurdle is your own emotional well-being. Not everybody has a partner that's aligned on the expense and the protocol, and I was very fortunate that mine was. It's isolating to be a caregiver. People don't really understand the depth of this disease because my child, when you met her, looked okay. And she gave everything, every ounce of energy she had to appear to be okay. But she wasn't. Your friends ask the right questions, but you can just see the eyes rolling back in their head when you start to describe what's happening that week. Really what they want to hear is, she's doing better. But that's not an answer I had for more than a year. Your family beyond your partner is significantly affected. Siblings have to take a back seat, and sometimes they're not old enough to understand, and they're scared too. There were a lot of things that we said no to, especially during COVID, because our daughter was ill, and that affected all of us. We did find some support with other Lyme families, Facebook, but some of those support also felt like pressure. Did you know? Have you experienced? You should try. This is what worked for me. Do you really want to see that doctor? It's just scary. And I think it has taken me nearly 5 years to get over the trauma, really, of this experience for our family. And she's still not 100% better. And I'm helping her learn that she deserves everything in life, no matter what happens with this disease. I think one of the worst parts is, for many of us, it's never over. It's not a full heal. There's always a chance it'll come back. There's chances to pass this to your children. It's a hard time.
I also decided to ask my brother about what his experience has been like as a sibling of somebody that has Lyme disease, and this is what he shared with me.
It all kind of depended on that era of my life, too. So when you first got sick, I was 13 to 15 age range. So at first I was more confused as to little things like I was confused and annoyed why we couldn't have gluten anymore, and why we had to start having less sugar, and why we had to stop having red meat, and all the little stuff that kids think about, because that's all I really cared about. I didn't think about sickness. I was just kind of annoyed that I couldn't eat steak as much anymore, which is so trivial, but that's the truth. And then as you get older, sometimes in high school and stuff, it was a little bit of resentment, only because you got a lot of extra attention, which, again, as a young kid, I was annoyed with and upset with. But then as I got, like, into high school and started recognizing, like, that's not her fault. She's just sick. So that's just how life is. And with that came stuff like, it was a bummer when our vacations had to change, or when we had to adjust our lives because of your illness. And again, as a kid, it was just kind of like, that sucks. And I didn't think about it that hard because health wasn't in the forefront of my mind. What was at the forefront of my mind is, what video game am I going to play next, and am I going to make it a practice for lacrosse? So that's kind of how it was. I mean, and then college came around when we got older, and I recognized I can do more than just sit around and ask how you're doing, because as a 16-year-old, 15-year-old, I knew the answer, but there's nothing else I could do. I couldn't drive. I couldn't do anything. So I guess while our parents had to do the actual stuff of helping you with, like, paying for stuff, taking you to doctors, all that stuff, all I could do was be like, make you laugh at the end of the day. But I think that's part of being a sibling too, is making it still a human experience and trying to remind you, I guess, that it was like, it's just part of life, and life goes on, and we're still going to be the same. So, yeah.
Great. Thank you so much for sharing, Connor. As you can see, Lyme disease is a very complex condition that alters the lives of Lyme warriors and their families. Thank you so much for joining me today. I hope I was able to open your eyes as to how occupational therapy services can help Lyme disease warriors cope with their new reality, find their purpose, and improve their quality of life. I hope to see you next time. Have a great day.